Body Logic Physiotherapy, empowering people to achieve better health.
Sarah, I'd love to know more about breathing and pelvic pain. Do you have any really good tips for how people can use breathing to help?
Yeah, so with our breath, it's one of the very few things in the body that we do involuntarily, but we can also control and do voluntarily. And even though we can't control a lot of functions in our body, like you can't intentionally think about increasing your heart rate and increase it, you have got to do exercise or something will trigger that other than a conscious thought. What we can do by having some control over your breath is actually have some control over other systems that generally you wouldn't have any control over. So your heart rate, your blood pressure, even your digestive system. By relaxing your breath and calming your breath down, you have some control over those functions, which then brings you into a more calm state and also calms your nervous system down. So when we talk about breathing for management with pelvic pain, often what we find with our patients is that they'll if you're experiencing the pain, you'll be feeling that you might be tight in your chest or tight in your shoulders. And very commonly pelvic pain comes with TMJ, temporomandibular joint problems or neck problems. And part of that is because of the breathing pattern that's often developed, which is, that upper chest breathing pattern, tight through the neck and shoulders and upper chest, and not even really using that nice, big, lower, much more efficient area down lower in our lungs. So when we address breathing, the goal is always to relax through the top part, so relax the head, neck, shoulders, upper chest, and work on that really lovely big rib expansion in the lower part of the chest, where the lungs are bigger and where air exchange happens much more efficiently and then requires less effort. And because there's more air coming in with your breathing, gradually your respiratory rate starts to slow down. So you're breathing less often, maybe slightly deeper or longer breaths, but because of that, everything's becoming more efficient. So the focus would be relaxing the upper, focusing on the lower, working and moving, and allowing your tummy to relax, because the upper tummy is another area that classically just gets wound up and tight with pelvic pain. And often you can feel that through your upper tummy, or you'll have that classic crease across the upper tummy. So what we're looking for is that nice relaxed upper tummy that's just moving with the breath. So as you're breathing in, your tummy will be rising, and as you breathe out, your tummy's falling. And just by focusing on all of that and being aware of what's happening while you're breathing, you'll find that your respiratory rate starts to slow and your stress levels will start to drop and you'll start to feel more relaxed. And as far as what to focus on, other than the parts of your body, what we try and work with is a breath in, and you can even use, it's called 4-7-8 breathing. So you're breathing in for a count of 4, holding if you can for 7. That can be tricky to start with when you're new, and then breathing out for a count of 8. So we're really lengthening through the breath out, which is when you'll be feeling that release physically and emotionally, and just letting go. And if you can't do 4-7-8 to start with, just start with what you can do and aim to get to those numbers. And you may find even within a few breaths, your numbers start to be able to increase. And once you've got to that, you'll find that you've really brought your breathing rate down, and you'll start to feel more relaxed with it as well.
I think this is a fantastic exercise for everyone to be doing right now through the COVID situation, with everyone feeling really anxious and stressed at home or in their work environments. It's such a lovely tip. So thank you.
No problem.